Good morning, doctor. For most of us, our job in the workplace are almost always going to be the source of stress and anxiety, which can lead to bad habits like smoking and overeating that affect your physical and mental health. But did you know your gum health can also be affected? Joining us to discuss how stress can contribute to periodontal disease is Dr. Stephen Daniel. Doctor, we are all aware stress leads to negative behaviors that affect our physical and mental health. Can stress also affect our oral health?
Yes, Debbie, unfortunately it can. I tell patients when they come to our office that you can't be truly healthy without a healthy mouth, and chronic stress seems to be something that can be a bit of a roadblock to both achieving and maintaining good oral health.
Doctor, what exactly is periodontal disease?
Periodontal disease is an infection caused by bacteria that we carry in our mouths. 1 out of 2 of us over the age of 30 in this country have periodontal disease, and it begins to attack and destroy the bone and the soft tissues that link the jawbone to the root of the tooth. That's how it can lead to loss of teeth, and at that point that's how it can begin to have an adverse effect on our overall health by elevating the risk of things like cardiovascular disease and stroke.
We know that gum disease causes health conditions like heart disease and Alzheimer's. What kind of risks does gum disease carry for pregnant women?
The data that we have suggests that untreated periodontal disease and the inflammation that is caused by that circulates through the body can trigger premature labor. Therefore, it can lead to premature low birth weight babies. And that seems to be the biggest risk for expectant mothers.
How can we prevent the disease?
Early diagnosis is the best way. And the periodontists, who are the experts in periodontal disease and its diagnosis and its treatment, can help your listeners by determining if there is a problem, and if so, what the extent of the problem is, and can work with the patient and the patient's dentist to deal with this problem when it's early on and relatively easy to take care of. And then once that's done, they can continue to work with the patient and the dentist to help maintain good oral health for the rest of a patient's life.
Doctor, is there anything else you'd like to add about periodontal disease for our audience?
Well, what I might say is this: the American Academy of Periodontology has a wonderful website, perio.org, Perio.org, and it has 2 things that I think your listeners may find useful. Number 1 is there's lots of information about periodontal disease, how it's diagnosed, how it's treated, and also some of the overall effects it can have on our health if it's not treated, and also a very easy to use way for your listeners to find a periodontist in their area who they can seek out and then work with them and work with their dentist to make sure that they're healthy and that they stay healthy.
Doctor, I'd like to thank you for taking the time to talk with us today. Have a great day.
Oh, it's my pleasure, Debbie. Thank you.
You're welcome. Bye.
Bye-bye now.